Time for your daily coronavirus update. This is from CBS News, and I'll archive it and link it below. Now, this is the February 12th update for China. Let's go ahead and get into the headline here real quick, and then we'll read some of these articles below. Coronavirus death toll tops 1,100 as China reports more than 90 new deaths. The death toll from the coronavirus outbreak topped 1,100 on Tuesday after officials in the outbreak's epicenter reported more than 90 new deaths in the past 24 hours. The announcement came as top scientists gathered in Geneva to try to answer questions about the new disease, with the head of the WHO issuing a plea for global unity against a common enemy that does not respect borders or ideologies. In the U.S., a federal quarantine ended Tuesday for nearly 200 Americans who have been at a Southern California military base for the past 2 weeks, health officials announced. The group of 195 people was evacuated from the epicenter of the coronavirus outbreak in China on a U.S. chartered flight in January, and no one in the group was found to have the virus. Dr. Kaiser, the public health officer for Riverside County, told reporters. Authorities said there were 45,118 confirmed cases of the disease in China alone, with 395 more in 24 different countries. That includes a new case confirmed Monday in San Diego, the 13th person diagnosed in the U.S. Like most cases, that patient was recently in the Chinese city of Wuhan. All but one of the fatalities from the virus have been in mainland China. With 99% of the cases in China, this remains very much an emergency for that country, but one that holds a very grave threat for the rest of the world. The director of WHO warned Tuesday, urging health officials and governments to use the window of opportunity that we have now. If you hadn't seen the updates the past 2 days, there had been 97 deaths, which was a record at that time, and 108 deaths the next day. That was yesterday. That was a new record, obviously. So today at 90, you see things beginning to slow. Now that's just one day. Obviously, we're going to have to track this thing over days and weeks to kind of see if that starts to trend downward. Yesterday, there were also over 3,000 new cases in China, and today with the update that was just over 2,000, which I'll talk about here below. So at least on that front, it seems like the numbers have slowed for a day, which again, as I've said in other videos, there really is no silver lining. The only thing you can really do is start to look for things to slow down. That's really the only positive that ever comes out of this. But it says here, the WHO has grown increasingly concerned about the virus being transmitted from people with no recent history of travel to China to others in their home country. Tedros said Monday that this community spread, which has been seen now in the UK and Spain at least, could be the spark that lights a bigger fire. So here's something visually for you. It's what I just talked about and what they talked about above. Chinese officials reported 94 new deaths and 2015 new cases of the novel coronavirus on Wednesday. That brings the global death toll to at least 1,115 and the number of confirmed cases to more than 45,000. This is also something I talked about a little bit yesterday as well, so let me touch on it again here. It looks like we have a new update. 39 more people on a cruise ship docked in Japan have been diagnosed with the coronavirus. So it looks like here 39 more people on board the Diamond Princess cruise ship off the coast of Japan have tested positive for the new coronavirus. So it says here it brings the total number of infected patients to 174. The Diamond Princess has been in quarantine since early last week after the virus was detected in a former passenger who got off the ship last month in Hong Kong. The ship is expected to stay in quarantine until February 19th. 14 days after the isolation period began. The ship confirmed the 39 new cases in a statement. And again, I've talked about this yesterday, and I don't know how much other information you've heard about this. I don't know how accurate this is, but I've heard that people have been saying that possibly the quarantine period should be extended to 24 days. I'm not sure if these companies are taking a look at that, but that's going to lead me into my next story. And it's something that I talked about above, but take a look at this real quick. Evacuees toss face masks in the air after completing quarantine. So here you see the individuals tossing their face masks in the air. Photo. For whatever reason, this one man is holding a football here. It says here some of the 195 evacuees who completed their 14-day quarantine east of Los Angeles on Tuesday threw their masks in the air like graduation caps before leaving March Air Reserve Base. Officials gave each a final health screening and deemed them coronavirus-free. Many boarded buses to take them to airports and eventually home. About 80 miles south, at a military base in San Diego, the Centers for Disease Control and Prevention said an evacuee there is the 13th confirmed case in the US. And we learned about this yesterday. That person has been isolated and hospitalized. The federal agency said the risk to Americans remains low, and recent research shows in many cases the virus is on par with the flu or cold in terms of severity. The 13 individuals in the United States have not yet had very serious illness. The agency's Dr. Ann Schuchat told reporters in Washington. In fact, most have had very mild courses. Something I was thinking about in terms of the photo, I don't want to come off like a buzzkill, which obviously means I'm about to come off as a buzzkill. But I totally get the excitement of it all. I can't imagine being quarantined for a 14-day period, what that must be like to be away from your friends and family and loved ones, but I just kind of had the feeling like the photo was a little bit in poor taste when I saw it, simply because you have individuals who haven't been that lucky. And again, this is just my take on seeing it. I'm definitely happy that these individuals don't have any symptoms of it at this time. I mean, any bit of good news we can get is something that we definitely need at this time. Like I've said in my videos in the past, there's a lot of fear and uncertainty out there, and I can't imagine what these individuals were going through while in quarantine if they had to see the updates on the news all the time coming out of China about all these individuals dying and everything. So again, the main thing is definitely happy that these individuals are disease-free at this point. Definitely happy for them, happy that they're going to get back to their loved ones and everything. But I think a bit more of a tempered celebration would have been in order. Something that maybe was done without the need for photographers there to go ahead and stage a photo of throwing your masks in the air. It's just me, but I just think it seems a little tacky, a little bit cheesy maybe. But again, the main thing is I'm definitely happy for them. So I probably just would have went a different direction and probably wouldn't have wanted to be involved in the photograph myself. Now, one final thing I wanted to get into before I got into my conclusion here for the day was this thing. And I've been seeing this making the rounds on the internet. And I've alluded to it in some of my other videos. But it's this whole idea that due to the lack of transparency from the CCP in China, and due to kind of the geopolitical nature of what we know about how China and other countries operate, a lot of people were suspecting that this may have been something that was lab grown, some kind of bioweapon that was made in a Chinese lab. So let's take a look at this headline real quick. CDC official downplays rumors of virus coming from a lab. The principal deputy director of the Centers for Disease Control and Prevention tried to tamp down rumors suggesting the new coronavirus outbreak could be the result of a man-made illness being leaked or deliberately spread from a Chinese lab. A reporter asked Dr. Ann Schuchat, and we heard from her earlier, about the reports during a news conference in Washington, D.C. on Tuesday. She says, based on everything I know, the pattern that we're seeing is quite consistent with animal-to-human acquisition, she said, backing the widely held belief that the virus jumped from a wild animal into the human population in central China. Other epidemiologists said that the virus likely made that jump in the context of markets still popular in southern China that put wild animals, domestic animals, food, and humans all in very close proximity. She further goes on to say, in the midst of new infections, it is very common for rumors to emerge that can take on a life of their own, Schuchat said, again referencing the suggestion that the new virus could have come from a Chinese government lab in Hubei province. Does that put it to bed for some of you? Again, I think the thing is when you're dealing with a situation where you have a lack of transparency, it really creates these kind of different ways people can go with how they're thinking about it. I wouldn't necessarily want to call it a conspiracy theory because we know how they do that in the news, right? We know that they use that term conspiracy theory to debunk ideas that they don't like. So I don't want to use that in this situation. But the reality, what I think, and probably what a lot of you out there are thinking too, if you're kind of up in the air on this, is when there isn't transparency, it really creates these problems. It really leads to situations where individuals can go off in a different direction with their train of thought because there's a problem with the forthcoming of information to begin with. To me, that's how a lot of alternative theories are formed. Back to what I showed at the beginning of the video, deaths versus the number of people recovered. There had been a time in the past, several weeks ago or so, where the number of deaths and the number of individuals recovered were really more even. So we really didn't have an idea of what the mortality rate was going to be. You would hear this huge range of predictions. Oh, it's going to end up being just flu-like, or it's going to be 50%, it's going to be 30%. But if you take a look at the numbers here on the screen, you've got 1,100 deaths and 4,700 people recovered. If you take a look at the math, you can see the mortality rates on the decline now, getting to be somewhere around 16% in terms of deaths and the number of people who have recovered. So what you would expect is that unless this is able to take hold in another city or province like it has in Wuhan, you would expect to see these numbers again start to skew more towards the lower side. So it'll be interesting, and it's going to take a lot of time to see what the ultimate mortality rate here is based on this. Again, you would expect it to be on the decline, but that's, again, assuming that it doesn't take hold anywhere else. If they're able to keep it mostly within the Hubei province, which, as we've seen, that's where a majority of the deaths and new cases are coming from, then you would expect to see that number decline as more of these confirmed cases start to move from confirmed case to the recovery phase. We'll see how the numbers change day to day and in the weeks ahead, but again, it's going to take a long time to kind of get a final idea of what the mortality rate will be from this. But what do you guys think of all this? Again, in the beginning, there was a time where it seemed like things were going to be really dire. Mortality-wise, it seems like things have started to slow greatly. What do you think? Where do you see things going from here? So, thank you very much, as always, for sticking with me and listening to what I have to say about this. Take care, everybody. Have a good day.